In today's video, we'll discuss fatty liver treatment. Non-alcoholic fatty liver disease is the most prevalent liver disease worldwide, and its incidence is on the rise. It's estimated that a full 20 to 30% of the Western population and 5 to 18% of the Asian population are affected by non-alcoholic fatty liver disease. There are still no approved medicines for the treatment of non-alcoholic fatty liver disease, so that all of the medications that are used off-label. In addition, there are no good and effective blood tests to diagnose the various forms of non-alcoholic fatty liver disease. The good news is, this disease is treatable, if not completely reversible, through lifestyle changes. Let us take a look at what we can do to treat fatty liver disease. But what is fatty liver disease? Fatty liver disease, as the name suggests, is the abnormal buildup of fat in the cells of the liver. There are many causes of fatty liver disease. Some of the more common causes include alcohol overindulgence, medications, starvation, infections with viruses such as hepatitis B and C viruses, or in some cases hereditary conditions such as Wilson's disease. In this video, we'll focus on non-alcoholic fatty liver disease. Non-alcoholic fatty liver disease encompasses two forms: non-alcoholic fatty liver and non-alcoholic steatohepatitis. Non-alcoholic fatty liver is buildup of fat in the liver without inflammation, whereas non-alcoholic steatohepatitis is the buildup of fat with inflammation and damage of cells in the liver. Non-alcoholic steatohepatitis can progress to fibrosis and cirrhosis, and once cirrhosis has developed, there's a 3% risk of the development of hepatocellular cancer of the liver. Non-alcoholic fatty liver disease is defined as an abnormal buildup of fat in more than 5% of the liver cells, in the absence of alcohol overconsumption and in the absence of other known causes of fatty liver. Treatment of non-alcoholic fatty liver disease focuses on lifestyle changes based on diet and weight loss, and the control of other sicknesses that frequently accompany non-alcoholic fatty liver disease, such as obesity, type 2 diabetes, and cardiovascular disease. In fact, researchers believe that non-alcoholic fatty liver disease is the result of obesity and insulin resistance, although the disease can sometimes appear in people with normal body weights. Weight loss of 3 to 5% is sufficient to prevent or reverse non-alcoholic fatty liver disease. However, to reverse inflammation and fibrosis, we will need to lose at least 7 to 10% of our body weight. Studies have shown that either a restriction on carbohydrates, that is, in starches and sugars, or a restriction on fats that cuts our daily caloric intake by 30%, or by 750 to 1,000 kilocalories per day, results in improvement in insulin resistance and in the buildup of fat in the liver. Daily consumption of sugar-sweetened beverages has been associated with a 55% increased risk of developing fatty liver disease. Diet sodas and beverages did not show this association. Besides this, the total intake of cholesterol and serum cholesterol levels have been associated with non-alcoholic fatty liver disease. Correction of hypercholesterolemia is therefore an important step in the management of non-alcoholic fatty liver disease. Weight loss with or without exercise, improved liver enzymes, reduced fatty infiltration of the liver, decreased inflammation in the liver, and decreased fibrosis in the liver. Interestingly, fortification of the diet with monounsaturated fatty acids, such as those found in olive oil and the Mediterranean diet, showed a significant decrease in liver fat after 6 months, even without weight loss. The same has been found with exercise. Moderate exercise, even without weight loss, reduces liver fat infiltration, known as steatosis. People who increased their activity level by 60 minutes or maintained their activity level above 150 minutes per week saw the most improvement in fatty liver disease. According to one study, however, only vigorous exercise was associated with decreased odds of liver fibrosis, and neither the duration nor the quantity of moderate exercise was associated with a reduction in fibrosis. Exercise intensity is measured in METs, and 1 MET is defined as 1 kilocalorie per kilogram per hour and is roughly equivalent to the amount of energy that is burned while sitting still. Moderate exercise burns about 3 METs, and vigorous exercise burns 6 or more METs. I've included a link to the compendium of physical activities in the description below, where you can check the METs for different forms of exercise. Even exercise that falls below the level of that recommended for weight loss is beneficial in fatty liver disease. And exercise does not have to be aerobic to be beneficial. Resistance training such as weightlifting also decreases liver fat infiltration even without weight loss. A number of studies have found that smoking predisposes to the development of insulin resistance and causes fatty liver disease. Smoking cessation is therefore an important step in the management of non-alcoholic fatty liver disease. Because alcohol can cause fatty liver, patients with non-alcoholic fatty liver disease should abstain from drinking, or at the very least, they should avoid heavy drinking. People who suffer from obstructive sleep apnea should seek treatment because the intermittent low oxygen levels and high carbon dioxide levels in the blood can lead to metabolic dysregulation, which can cause fatty liver disease. The gut microbiota has been recognized as a key player in the pathogenesis of non-alcoholic fatty liver disease. Researchers believe that the microbiota can produce molecules that make their way to the liver and stimulate the liver to produce pro-inflammatory cytokines. Maintenance of a healthy gut microbiota is therefore beneficial in the treatment of non-alcoholic fatty liver disease. The use of medications to treat non-alcoholic fatty liver disease should be limited to those patients with biopsy-proven non-alcoholic steatohepatitis and fibrosis. Vitamin E has been shown to decrease fatty liver infiltration and inflammation, but did not decrease fibrosis. Long-term treatment with vitamin E, however, has been associated with increased all-cause mortality, cardiovascular mortality, and prostate cancer. Because of the increased cardiovascular mortality, vitamin E should only be used to treat non-diabetic patients with non-alcoholic fatty liver disease. Since insulin resistance plays a major role in the onset of non-alcoholic fatty liver disease, drugs that improve insulin sensitivity have been tried in its treatment. Pioglitazone, which is an anti-diabetic medication, decreases inflammation in the liver in patients with and without type 2 diabetes and with biopsy-proven non-alcoholic steatohepatitis. Pioglitazone also decreased fibrosis. Pioglitazone, however, has been associated with thinning of the bones, fluid retention, and weight gain. Most of the studies done on bariatric surgery show that bariatric surgery decreases non-alcoholic fatty liver disease and reduces inflammation in the liver. With regards to fibrosis, however, the results were variable. Some of the largest studies suggest that fibrosis worsens after bariatric surgery. People with non-alcoholic fatty liver disease are at increased risk of cardiovascular morbidity and mortality. Therefore, All patients with non-alcoholic fatty liver disease should have aggressive management of their cardiovascular disease risks. The cholesterol medications known as the statins have been shown to decrease liver enzymes and to reduce cardiovascular risk in patients with non-alcoholic fatty liver disease. Finally, coffee has been shown to have a favorable effect on metabolic syndrome. And those people who drank 2 to 3 cups of coffee per day had a 38% decrease in the risk of developing hepatocellular cancer of the liver and a 46% decrease in the risk of dying from chronic liver disease. More coffee provided more benefit, and there's an inverse association of coffee consumption with liver fibrosis in patients with non-alcoholic fatty liver disease. Thank you for watching. Don't forget to like and share this video and subscribe to the channel so we can continue to bring you interesting topics in medicine. And don't forget to hit the notification bell so you can receive notification when new videos come out.